Assalamu alaikum and welcome to the platform of Pharmapedia once again with a new drug that you can see, BudesoNide. So what is the actually BudesoNide? It's a matter of life and a breath. What is BudesoNide? It is used for the treatment of long-term management of asthma and an anti-inflammatory and anti-allergy medication used to decrease or prevent the respiratory tissue response to the inflammatory process. So what is the basic pharmacology and the mechanism of action of BudesoNide? Let's check it. So here you can see the bronchi nucleus. When the inflammatory stimulus seen in the bronchi cell, ultimately the glucocorticoids receptor, here you can see the glucocorticoid receptor GR in the red color. Here the BudesoNide bind with the GR, ultimately increases the gene repression and decrease the formation of cytokines that are the interleukins and human necrotic factor alpha. It decreases the activation of eosinophils, it lead to the apoptosis. So it also decreases the activation of inflammatory cell. So here you can see the BudesoNide is an anti-inflammatory in action. It decreases the T lymphocytes activation, mast cells, macrophages and dendritic cells. Now the pharmacology of BudesoNide, here I am discussing. So what is the BudesoNide? BudesoNide is a glucocorticoid and it binds with a glucocorticoid receptor, as you see in the previous picture, which exerts significant local anti-inflammatory effect. So it is the anti-inflammatory drug. Now its indication and dosage, it is available in the capsules form, in the granules forms and in the rectal dosage form. In the mild to moderate Crohn disease affecting the ileum or ascending colon, it must be given per oral with an adult dose of 9 mg once daily for 8 weeks to be taken in the morning. Alternatively, 3 mg 3 times a day for 8 weeks, reducing the dose gradually over 2 weeks following the treatment. In the colitis colitis by mouth, adult dose is 9 mg OD for 8 weeks to be taken in the morning or reduced dose. Now in the treatment of the autoimmune hepatitis for the induction of remission and the maintenance therapy, in the induction of the remission the dose per oral adult is 3 mg 3 times a daily, that means TDS, and the maintenance therapy 3 mg twice daily, that means BD. Now in the granular form, it is used to treat the mild to moderate Crohn disease affecting the ileum or the ascending colon. Crohn's disease is very bad disease. It is an inflammatory disease, so BudesoNide is an anti-inflammatory drug. That's why it is used in the treatment of the Crohn disease that affecting the ileum or the ascending colon. Again, per oral. Adult dose is 9 mg once daily, that means OD for 8 weeks to be taken in the morning after 30 minutes before breakfast, because it have the greater bioavailability in the empty stomach. Reduced dose gradually over 2 weeks following the treatments. Now in its the rectal form, it is used in the treatment of ulcerative colitis affecting the sigmoid colon and rectum, with the adult dose 1 meter application once daily for up to 8 weeks, and it is equivalent to 2 mg BudesoNide. It is also used in the induction of remission of mild to moderate active ulcerative colitis by mouth, that means per oral, with the adult dose of 9 mg OD for up to 8 weeks. Its other indications are active microscopic colitis, mild to moderate Crohn disease affecting the ileum or the ascending colon. Okay, it is also available in the enema form by rectum. 1 enema daily for 4 weeks to be administered at the bedtime. Its other indications are eosinophilic esophagitis, because basically it is an anti-inflammatory drug, so it has an anti-inflammatory action with the adult dose of the 1 mg twice daily, that means BD for 6 weeks. Treatment may be extended to up to 12 weeks if required to be taken after food. Now its interaction, it is highly interactive with corticosteroids Why? Because it is a glucocorticoid and it have a action with with an interaction with the other steroids. That's why it is highly interacted with corticosteroids. Caution: it must be used with caution in the autoimmune hepatitis, because all of the steroids are must be used in the caution in the autoimmune hepatitis. Now the side effects, common or very common side effects with oral use: muscle twisting, edema, oral disorders with the rectal use, diarrhea, GI disorders, hepatic impairment. Manufacturer advises with this specific brand advises avoid in cirrhosis because of risks of increased exposure, limited information available. Okay, with this specific brand, manufacturer advises avoid, no information available, so it is basically the manufacturer special advices, not with the generic, with the brands or with the manufacturers only. So in the renal impairment, manufacturer advise caution in mild to moderate impairment only with this brand name, only with this brand name. Avoid in the severe impairment. Monitoring requirements must be advised. Direction for administration: with oral use, granules should be placed on the tongue and washed down with the water without chewing. So what is a prescribing and dispensing information? With oral use, flavors of granule formulation may include lemon. Patient and carer advice: with oral use, patient or carer should be given advice on how to administer budesonide granules. So that's it from this drug and this video. Inshallah, meet with a new drug in the next video. Till that, take care. Allah Hafiz.